continuing these practices of incarcerating people for simply trying to alter their consciousness, trying to get some joy, that is the most ridiculous thing that we can think of.
You're listening to the Mental Health Download from the nonprofit Mental Health Association Oklahoma. I'm Matt Gleason. Today, Mark Davis, who serves as the Mental Health Association's Chief Programs Officer and is a longtime mental health professional, is going to interview Dr. Carl Hart. Dr. Hart grew up in a low-income neighborhood in Miami where drug use was prevalent. And the truth is that he even used and sold drugs. However, that life led him to the Air Force and later to the esteemed role of Columbia University professor. Dr. Hart is acclaimed for his research, which some may call controversial, particularly in regards to substance use and the case that Dr. Hart makes for decriminalizing all drugs in America. And that's why we're thrilled that Dr. Hart is going to be a keynote speaker at Mental Health Association's annual Zero Mental Health Symposium coming up in October. His keynote is titled Drug Talk for Grown-Ups. I love that. In it, he will be drawing upon his own personal journey and more than 25 years of experience as a neuropsychopharmacologist. Through his lens, Dr. Hart will convey to the symposium attendees how society is constantly misled about drug use and addiction. And he'll also explain how misconceptions about drug addiction distract our attention away from real concerns and lead to bad policies, immeasurable suffering, and countless preventable deaths. That's all to say that Dr. Hart's research fits perfectly into the Zero Symposium's theme this year. It's resilience, recovery, rethink mental health. After all, Dr. Hart is truly rethinking mental health. Okay, let's get to the interview. The Mental Health Download starts now.
Before we get into your eye-opening research, I want to know just about you a little bit. Why did you join the Air Force after high school?
Because I suspect you know I'm a Black American, and coming up in the South in Miami, not much economic opportunities, poor education. You know the consequences of the transatlantic slave trade still here, and so
Right.
it was a way to get a job.
And so how would you say that shaped you? It helped you with employment. It helped you get out of I'm going to just say it too, I'm Afro-American as well. It helped you it was an escape to get out of the hood. How did that shape the person that you are today?
Yeah, like I don't like to say like Air Force or anything was an escape out of the hood, because it implies that I'm trying to get away from my people, and that wasn't it. It just provided economic opportunity, and it also provided educational opportunity, and it gave me an opportunity to see the world a little bit and see how things were done differently. All of my time was spent overseas, primarily in the UK, and it gave me a chance, an opportunity to see how Black people could be treated differently in a different space. Coming up in the South and only being in the South, it's in these subtle ways you are told what your place is, and you kind of know your place. But in the Air Force, it allowed me to see that that's not necessarily your place, and you can do some other things if you put the work in, and if people provide opportunities for you. And so that being in the UK really helped me to see things a little differently, even though the UK had their problems, and they still do. But it was for me better than being in the American South, and then allowed me to go to school and gave me the sort of resolve to be able to give something back to my community once I got the skills.
Right. Doing some research on you, reading about you, Dr. Hart, and I have your book, High Price, here in front of me. You went on to get your doctorate in neuroscience because you wanted to solve the drug addiction problem. And I recall you stating that you had this very this wonderful, idyllic kind of plan that you could truly solve the drug addiction issue in your neighborhood or around the communities in which you grew up in. Do you still think that we, as American, we can actually effectively address the drug addiction issue that we have going on?
Now, you point out, rightfully so, when I got these skills and then I could see I could get a PhD, and I wanted to study neuroscience to figure out what was the brain mechanism responsible for drug addiction. And I thought that if I found that mechanism, I would be able to solve the problems in my neighborhood, because at the time I thought that the problems was related to drug addiction. I thought drug addiction was a problem. Problems like high unemployment, poor education, crime, all these things I thought was related to drug addiction. And but then later, as I studied more, I learned that I was wrong. Drug addiction has little to do with these problems. The society is telling us that the problems are related to drug addiction, but that's a lie. The problems are the same things that they always have been. I mean, it's like you have to make sure people are educated. You have to make sure people have economic opportunity. You have to make sure people are plugged into a society. I mean, if you add drugs or anything to the mix, that will exacerbate the problem, or it will cover the problem. But the problem oftentimes don't have anything to do with drug addiction. We've just been using drug addiction as a distraction not to go after the real problems, which are far more complicated than drug addiction. Drug addiction is a relatively simple thing to solve. But we pretend that it's drugs, and it's not drugs.
Mm-hmm. Got you. I hear, you addressed in various components of the social determinant factors. You mentioned, access to health care, jobs, employment, mental health care services, access to food, assistance, child care services, all those other supporting factors to help address the real problems, as you stated, if I'm hearing you correctly.
That's absolutely right. Absolutely.
Yeah. So let's do a little time traveling here, Dr. Hart. If I could send you back to 1986, when Congress passed the laws punishing crack cocaine trafficking in ways that were, as you will know, 100 times more harsh than those for powder cocaine, what's the most powerful statement that may have swayed the lawmakers in your favor?
In my favor?
Yeah. What would be the most powerful information, whether it's scientifically based, that you would have presented to sway the lawmakers' mentality or their narrative in regards to how they addressed the issue?
Well, in 1986, I was caught up in that misinformation wave. So I believed what Congress believed. I believed that crack cocaine was the main problem that we faced in communities like the one from which I came. So in 1986, I would have been equally wrong, but somebody who was right at that time but was ignored was somebody, James Baldwin. James Baldwin said in I think December 1986, he was like, we got this wrong, and the only people who are going to pay the price are poor Black people and people who are on the margins. And so James Baldwin argued that we should have regulated the drug market because the people who are wealthy and the people who have means are still going to get their drugs. The only people who are going to be hurt are poor people, and the people who are going to make a whole lot of money off of these laws are law enforcement, prison industrial complex. All of those people, he pointed out, will get paid. And he has been absolutely right.
So if the war on drugs never happened, what do you think our society would look like today?
The war on drugs, that means a lot of things to a lot of people. Like the war on drugs really began at the federal level in this country in 1914. So if we think about if the war on drugs would have never happened, then Americans would be living more consistent with the Declaration of Independence, where the Declaration guaranteed us life, liberty, and pursuit of happiness, even if that pursuit of happiness meant that people were allowed to use drugs in their pursuit of happiness. That meant that drugs would be regulated and people could be like adults, like alcohol. They could go and buy high quality drugs, and they know how to do it. Education would be better surrounding these things. We wouldn't be lying about these things. So these things would be available like alcohol, and
Right.
adults would be responsible for their use.
Right. Okay. So
And then
this is
we would
kind
have
of
a large budget available for helping people in terms of all of those psychosocial services that they need, as
right.
opposed to having this over $1 billion a year go into, well, actually over $30 billion a year go into this sort of war on drugs thing.
Right. Put it into treatment. And as you said before in many of your talks that I've looked at, and make sure that the funding is used properly to help people with their issues and not to go to law enforcement and building more jails.
That is correct.
Yeah. So this is kind of a personal questions in a sense. What are some of your most absurd and just plain wrong comments or views that you've heard over the years about your research?
About my research?
Yes.
I guess one of the criticisms is that I'm biased. And so I have an agenda, that sort of thing. And it's stated as if that somehow causes me to lose credibility. Of course, I have an agenda. My agenda is to get people to use evidence to support their position.
Right.
If it makes us feel uncomfortable. Yeah.
Right.
So that's one of the major sort of criticisms that I get.
Okay. And so you've also, in regards to your research as well, and I love this statistic here and how you've backed it with your research and digging into the details. You've shared it that 80 to 90% of people who actually use illegal drugs or drugs don't really have a drug problem. But why do Americans think the very opposite?
Well, because that's exactly right. Americans think the opposite because we, like many people, especially us, we are hypocrites. And so let me break that down.
Yeah.
If we are hypocrites, then we have to justify our behavior that is inconsistent. And so when we think about, for example, people say, why are you arresting those large numbers of Black folks in disproportionate number? Why are you arresting those large number of people? Why are you not allowing them the liberty and so forth? We have to justify it. And so we can say those evil drugs have changed those people. Those evil drugs made those people behave in this way. And then our movies, our documentaries, our education, our news, our media, everything follows in telling these stories to justify the horrible crimes that we commit against our people. Now, these crimes are things like the mass incarceration. These things are the mass subjugation of various groups. And so the media, the documentary filmmakers, all of them play a role in justifying this horrible crime committed against people.
In one of your talks, also you reference a study that was done with lab animals, and you basically address some fallacies or some myths around that study about lab animals. You stated that they having an attractive alternative will not self-administer drugs until death if given an alternative. And then you follow that up in your own research with human subjects. Can you tell us a little bit about the people you studied and what you discovered thanks to their participation?
Yeah, so we go back to the animal studies. When I was a college student, we were told that animals will self-administer, and given the opportunity, they will self-administer drugs like cocaine, heroin, amphetamine. They will self-administer these things until death if you allow them unlimited access. And then this was given as evidence of how powerfully dangerous these drugs are. But then, as I learned, there were like other studies that were showing that if you gave the animals an alternative and you gave them unlimited access to these drugs, they wouldn't take these drugs until death. And in fact, they would engage in these other behaviors like um, interacting with a sexually receptive mate or playing with toys or sweet treats. And so we tried to extend that to the human laboratory. We brought people into the lab, people who were the first study, people who met criteria for a cocaine use disorder, cocaine addiction. And we gave them an opportunity to choose between a hit of crack, a nice hit of crack, and some monetary amount. In the first study, I think it was like $5 cash, $5 merchandise voucher, or something of that nature. What we found was that when you gave them a choice of only something like $5 versus an unlimited access to crack, they took the money and the drug on about the same number of occasions. And then subsequent studies, we found that if you increase the monetary amount to something like $20, they almost never take drugs. They take the money. And so what it told us is that people who meet criteria for a substance use disorder behave rationally, especially when they have options. These folks can and do behave rationally. And so that's just like anybody. And so it provided evidence that these drugs were not as addictive as had been touted, and that these drugs conform to the normal behavioral principles that we have always known.
Right. This is really fascinating. I think it's very enlightening to individuals who don't have a medical background or haven't studied this, the addiction impact on individuals who engage in drug use. So this is really fascinating, the results that you discovered here. Were the results what you expected before the study actually began, that individuals would actually engage in a more attractive alternative as opposed to drugs? Were the results what you expected, or were they opposite?
No, the results were not what I expected. I mean, although some of my colleagues and people were smarter than me, and they would have expected this, but personally, I thought that I was still caught up in that sort of web of misinformation, in that I thought crack cocaine was so addictive that you gave somebody who met criteria for crack cocaine addiction that they would take drugs no matter what. They would any opportunity to take crack cocaine, they would do it. And so I thought that the $5 option wouldn't have phased them, but I was wrong. I was dead wrong. And but if I had read the literature more carefully and really studied the principles of behavioral change, I would have predicted right. But I was wrong. I was wrong because I was ignorant.
Yeah, I have to be quite honest. When I looked at your study and the results, I was pleasantly surprised as well. I thought, wow, I think we got to give, I don't know if credit is the right word, but we definitely have to look at addressing this through a different lens. Is kind of where it drove my thought process. So it was really fascinating research you did there. I guess along those same lines, you talk a lot about poverty and crime and drugs and the intersectionality between those three. What in the communities across the country, Dr. Hart, when you pull drugs out of the equation of crime and poverty, is that the true answer? Because I've heard you address that in many talks before.
Yeah, we have to pull drugs out of the equation, and we have to look at people's behavior. A second ago, you pointed out that people not aware of, but they're not in the medical community. This is really not about the medical community, because the medical community too has screwed this up. This is about sound behavioral analysis, sound This is about psychologists, social workers, all of those folks getting back to their roots and looking at the individual and the individual's behavior and leave the nonsense alone, like speculating about what's going on in the brain and what the drug is doing here. Leave that nonsense alone and look at the individual's behavior, the individual environment, the circumstances. All of those sorts of things are far more important. And if people just simply get back to the careful behavioral assessment, they will actually help to solve people's problems.
Yeah, well, I'm maybe I'm biased here, but again, I've watched several of your talks, and like I said, reading through your book, and I respect and highly value and appreciate your complete transparency and your honesty and your passion to really get to the core of what we're struggling with. And I've also viewed you, and I hope this is okay to say, but I think I've seen you quite frustrated and agitated over, I guess the most polite way of saying it is the ignorance around the whole addiction issue. And that's refreshing to me personally, to hear someone just speak openly and plainly and honestly about how to really strike to the core of the addiction issue that we're addressing across our country, and discontinue the trivialization of it, if you will. So thank you for that. I really do want to acknowledge you and express some appreciation for you just being boldly truthful and honest when it comes to these issues. Along those lines, you've talked about selective targeting and racial discrimination and how they've contributed to the horrifying statistics that 1 in 3 Black males can expect to spend time in prison, and by contrast, the white males, it's about 1 in 20. So, do you want to just comment a little bit about that?
Yeah, just yesterday, I just got back from Ghana, and many Americans many Americans don't know because they've been miseducated, that the transatlantic slave trade that resulted, that happened in this country, many of the enslaved people, the vast majority came from Ghana, and so I went back to Ghana there, and I just got back, and this is the year return where African Americans can go to Ghana and get dual citizenship and participate and so forth. And so when I think about the transatlantic slave trade, and I think about what we're continuing to do in this country with our laws and our sort of racial discrimination in the enforcement of these laws. When I say racial discrimination, I mean this precisely, as people always dilute the term. I mean this, that where disproportionate numbers of people are targeted because maybe it might not be because of their race, but it happened as a result. A disproportionate number of people of this specific racial group are negatively impacted by actions of law enforcement or something. That's racial discrimination, and that's what we have going on when it comes to drug law enforcement and many enforcement of a lot of laws. But drug law enforcement is like my expertise, and so that disturbs me because it continues this long, awful legacy of the transatlantic slave trade, and further subjugates a selected group of people. And we know it's happening in this country now, and we use language to decrease the impact of this awful, awful practice that we have engaged in. And so, you sense right my frustration. I am frustrated because we are using science or scientists to further the goals of this horrible discriminatory practice, and we are using professionals to do the same sort of things. And so when you read as much as I do and know as much as I do about this here, my literature and that sort of thing, it's so clear that it's wrong, and I don't want to see further generations negatively impacted by these awful practices, especially when we can be working to enhance people's joy and time here on this earth. And so continuing these practices of incarcerating people for simply trying to alter their consciousness, trying to get some joy, that is the most ridiculous thing that we can think of.
Continuing with that kind of narrative, you've also made some suggestions for reversing the trend. And so talk to me a little bit about meaningful employment to make a difference.
Yeah, we can think about like I have a job. I love my job, and I know I have to get up every morning and do it because I love it, and it allows me to take care of my family. It makes me feel proud to be able to support my family. All of these kinds of things. And so, if we want to make sure that people have the skills to be able to be gainfully employed, and they can do the same, and then they will have a stake in this society to make the society better, to make sure that they protect what we have in this society. Those folks, but we have to make sure they're plugged in. Have to make sure they have education, have the right skills. We have not done that. We can shift some of the focus of the war on drugs and these other awful policies to make sure that people have economic opportunities. I'm thinking about this is just one simple example. Right now, 10 states in the United States have legalized weed for recreational purposes, created a whole burgeoning economy and these economic opportunities for a number of people. We can do that on the federal level and make sure that people get plugged in, have jobs, and then also people have jobs in providing this psychoactive plant to folks for their joy. And so that's where we can create jobs there. And we certainly have in those 10 states. And those 10 states like Colorado and Washington, they have no interest in going back because it's a lot of economic opportunity. And they're getting people plugged into our system, into our values and so forth. So that's a great thing.
One of the things I think that you spoke to in many of your talks is also the decriminalization of all drugs. With that, if we were to go that route, should we expect more deaths from overdoses and a rise in crime?
So let's just be clear that we already have decriminalization for wealthy white folks in our society. We already have that, right? Then decriminalization simply means that people are not going to jail for drugs. They might get a warning. They might get that's a personal drug use. They might get an administrative fine, but they're not going to jail. That's all criminalization means, that we will stop arresting people for personal amounts of drugs, and we will stop doing that. That's all that means. So when people start talking about more overdose and that sort of thing, again, they are conflating the issues and crime. They're conflating the issues. Number one, drug overdoses are caused primarily because of our repressive drug laws. Let me give you an example of that. We can think about opioids. One of the things that has happened with the opioid market, heroin is the opioid that people who use illicit opioids are primarily seeking. Heroin, one of the things that's happened with the illicit market is that illicit manufacturers have been tainting heroin with something like fentanyl or some more potent opioid because it requires smaller amounts, and that means that if they lose some supply, they don't lose as much money. So you stretch your product by having more potent opioids in the market. Now, the people who are using these drugs, unbeknownst to them, their drugs has another more powerful opioid. And if they take the same amount that they usually take for their heroin, some cases they overdose, in some cases they die. Now, that sort of adulteration of the heroin market occurred as a result of our restrictive drug laws, not because of the drugs themselves. That's on us. We could easily regulate the market and make sure that there's some sort of quality control, just like we did during when alcohol prohibition was over. During alcohol prohibition, we had a lot of illicit, adulterated alcohol in the market, and people died because of this. They got alcohol poisoning, they got sick, very ill. But when we regulated the market, like now today, you don't see any adulterated alcohol. That all of those related problems went away. And so the same is true with our drugs like heroin and other so-called illicit drugs. So this is a problem of the drug regulations, not the drugs themselves.
I got a couple more questions and we'll wrap it up here, Dr. Hart. Again, I want to respect your time here. What could we, just real quickly, what can countries like Portugal and the Czech Republic teach us about substance use?
Yeah, so there are about 30 countries around the world that have decriminalized all drugs. Again, decriminalization is just treating personal drug use like a traffic violation. You might get a warning, you might get a fine, but you're not going to jail. Portugal, the Czech Republic, Spain, all of those countries are a part of those countries that have decriminalized all drugs. Now, one of the things that what we can learn from them is that, well, we don't have to incarcerate our population. But I don't think we're really interested in learning that lesson from them, because one of the things that we should understand that the countries that have decriminalized drugs, all drugs, and have better drug policy, these countries are primarily racially homogenous countries. That is, they see these people, they see drug users, they see these folks as being their daughters, sons, their brothers, their sisters. Unlike in the United States, we have racial diversity and we see these people as being others. And we are comfortable with subjugating them and mistreating them. And so really, we don't really have an interest in making sure that those other people have the pursuit of life, liberty, and happiness.
Along those lines of decriminalizing drugs and us learning from other countries, you've mentioned, which I find quite fascinating, you've talked about free drug purity testing sites, similar to what they have in the Netherlands and Spain and Switzerland. Talk just quickly about that. And I also want to know your thoughts about needle exchange programs.
Yeah, you raised the issue earlier about overdose, and overdose occurs primarily, or a large part of it, a substantial proportion of people who overdose do so because they get adulterated substance. They don't know what's in their substance, and this could be dangerous. And so places like Spain, places like Austria, they have implemented these testing sites where these are free anonymous drug testing sites where you can submit small samples of your drug, and they will give you a chemical breakdown, readout of what's in your substance. And then you can see if it contains an adulterant or something that's potentially dangerous, not to take it, or to scale back your use. And so this has really helped in terms of preventing potential drug damage or horrors or harm. And so United States, we have this technology, but we just haven't shared it with our population, in part because we are being moralistic about this and saying that people shouldn't alter their consciousness with this particular drug. It's okay to alter your consciousness with alcohol. That's fine, but not with these drugs. That's arbitrary and ridiculous.
Mm-hmm. And again, do you have any position on? I guess this kind of falls in line with maybe your stance related to the purity testing sites. But what are your thoughts about needle exchange programs?
Needle exchange programs, of course, they are important and valuable, and they have helped to decrease bloodborne illnesses because, they decrease the likelihood of people sharing needles, where we get these various types of bloodborne illnesses, and you get abscesses, you get all of these awful things that are not the drug, but just related to people not having clean works, people not having access to appropriate equipment. And needle exchange programs deal with that. And they also provide a lot of education. So needle exchange programs are a valuable tool in this. I just wish that we didn't need them, and people could just go to their healthcare professionals and get what they need.
Correct. I agree. The reason I was curious as to your perspective is because, I hear so much negative talk from individuals or I question kind of their understanding of the value of it and the laws that don't respond favorably to needle exchange programs. And so I was just very curious as to what your stance on it was. So this is the last question, Dr. Hart, here. If the Zero Symposium attendees, when they go back to their communities, what would be some of the key points from your keynote that you would like people to remember?
One of the major things that I want people to know is that if the vast majority of people who use any particular drug don't have a problem, then we can't blame that drug. It requires us to look further past the drugs, and it requires us to look at the person, to give that person a comprehensive assessment and try to understand what's happening with that person, what's happening in that person's environment. That's number one, I hope that these people get from this. Number two, I hope that these folks understand that people who use psychoactive substances to alter their consciousness are doing so and they're doing so seeking joy, seeking relief from anxiety, from whatever. It's done with these good intentions in order to be happy. And that should be a goal that we all seek, happiness, to be. And so these people, folks who use drugs, are not somehow morally corrupt, somehow morally inferior. It has nothing to do with that. It has to do with them seeking joy. That's another thing I hope they understand. And I hope also that they understand that we have used this drug issue to further marginalize those people on the margins. Yeah. And we are participating in subjugating those people. And it's not right. And our role in subjugating these people are not that different from the role of the slave owner who had subjugated the enslaved people. And so I hope people understand that. And I hope that these folks can look at themselves and look at their own drug use, whether it's alcohol, whether they've smoked or weed in the past, whatever. I hope they can look at their own drug use and see themselves in the people who we have vilified.
Well, this has been highly valuable, Dr. Hart. We truly appreciate your time and your expertise, and I look forward to greeting you and escorting you here at the Mental Health Zero Symposium this coming October. Thank you so much for your time.
Thank you, and you have a good day, Mark.
All right, you too. Bye-bye. Yeah, so wow, what an interview with Dr. Carl Hart. While he has such a unique perspective when it comes to addressing the substance abuse issue and addiction that is ravishing so many communities across the country, his narrative, his viewpoints, his scientific research all really pushes the narrative for us to really rethink how we're trying to tackle, and I emphasize trying to tackle the drug addiction problem and the substance use issue across the country, but how unfortunately, we're missing the mark somewhere because we're unfortunately not trending in the direction that we need to. And I think Dr. Hart really brings forth another attractive alternative for which we should maybe think and give some merit to, at least to start to address this epidemic in a different fashion or form, because at this point right now, we're seeing opioid addiction, heroin use, the introduction of a very dangerous chemical, fentanyl, introduced into our communities, and it's killing people. The drug use is up, drug overdoses are up in the communities across the country, and I think Dr. Hart really brings to the forefront a new and a fresh perspective that what's critical about his perspective is not just some arbitrary, random viewpoint that he's spouting out. It's actually scientifically based. It's research. It's studied to look at different ways to effectively address this issue of addiction across the country. So we really look forward to having everybody at the Mental Health Zero Symposium here in October. You can go to zerosymposium.org for all the details. So as we always say here at our agency, go do good things.